Hello everyone, it's Dr. Potter from Sanctuary Functional Medicine once again to talk about mold and how it affects our patients and how we can help you be free from mold toxicity and its curse on you. So with that, we are going to spend the next hour talking about the symptoms someone may be experiencing when they have mold toxicity. Now, before we get started, I do want to mention a few things. One, if there are those of you who are out there now clicking in can hear me, please do say hello so I know my voice is coming through. Try to check the audio video, but always there's glitches, so let me know you're there. Besides that, I do want to say this is not about diagnosis and treatment. We cannot treat you just by giving you a few things or answering your question over the internet, Facebook. We need to see you in person, and we need to use all the tools that are available to make the right diagnosis and do the right therapy. So if you have questions about this, we're glad to see you as a patient. We are taking patients, new patients. Stephen at 615-815-5941 can help with that. But at the very least, you need to talk to your doctor who may be caring for you for mold toxicity or for other issues, and see if this is an appropriate therapy before you implement that. So again, today though, we are going to be talking about some of the symptoms that our patients present with, or that you may be wondering, is mold a possible cause, root cause of what I'm experiencing? With that, I want to start out by saying just about any symptom could potentially be a sign of mold toxicity. So fatigue, headaches, tingling, hand going to sleep, GI issues. There are a lot of things. We're going to talk about the specific symptoms more in a minute. What I want to get across now is it is not just having one or two of those symptoms. It is the fact that you have a multi-symptom, meaning you have several symptoms, and it's multi-system. It's not just one system that's affected. So if it's just your lungs and absolutely nothing else, it may not be mold. If it is just skin and nothing else, it may not be mold. Now, we need to make sure that your other systems are not being affected, but we do approach things from a shoemaker approach. There are several different ways to look at this in terms of diagnosis, but that's what, if you're thinking, do I have the symptoms of it? What you're really asking, should I be diagnosed with mold toxicity so I can start getting treated? Because ultimately it's not just knowing what you have, it's knowing what you can do to get better from what you have. So with that, do you have the chronic inflammatory response syndrome, in which a biotoxin, a chemical substance produced by an organism that has poison or a toxin for another organism? Are you being affected by one of those biotoxins? Because it's not just mold, it can be Lyme, actually produces toxins. Red tide from the poisonous algae down in the oceans that has been plaguing the Gulf in the past year. It could be toxic algae bloom in a freshwater lake or river when fertilizer or other chemicals are dumped into it. It could be actinomyces or other bacterial chemicals that are released into a water damaged building. So it's not just mold, but that syndrome, the chronic inflammatory response syndrome, is what we're looking at. Is your body chronically inflamed, inhibiting your body's ability to repair, inhibiting hormones to be functioning normal, inhibiting a lot of different aspects of your body, and that's why we say it has to be a multi-system, multi-symptom process. So some of those symptoms we're going to go through, you're going to say, well, that could be from thyroid, that could be from leaky gut, that could be from adrenal fatigue, that could be from an Epstein-Barr infection. Yes, that's why we want to take the time to make sure we are diagnosing correctly and not just blaming everything on mold. We will try to rule it out as much as we can. So in this chronic inflammatory response syndrome, we are looking at which parts of the immune system are upregulated, and is mold a possible cause of that. So let's talk about symptoms for a moment. I'm just going to read off the Surviving Mold website, which is kind of the standard when you're looking at mold diagnosis. Fatigue, weakness, aches, muscle cramps, unusual pain, ice pick pain, headaches, light sensitivity, red eyes, blurred vision, tearing, sinus problems, cough, shortness of breath, abdominal pain, diarrhea, joint pain, morning stiffness, memory issues, focus concentration issues, word recollection issues, decreased learning of new knowledge, confusion, disorientation, skin sensitivity, mood swings, appetite swings, sweats, temperature regulation or dysregulation problems, excessive thirst, increased urination, static shocks, numbness, tingling, vertigo, metallic taste, and tremors. And that is just the list that Shoemaker's put together. And having been to his conference a couple of weeks ago, what he did was take all the different symptoms that people had reported to him and others in his group that potentially came from mold, and he did a statistical analysis with some help. As he would say, he didn't quite understand all the statistics behind it, but those are the symptoms that stand out as when you have. Those are grouped. You can see that on their website or in places where they're talking about Shoemaker's approach. They put that in 13 different categories. If you have symptoms in 8 of those 13 categories, 1, you have a multi-symptom, and 2, you have a multi-system process going on. Now, again, a lot of those things could be caused by a lot of other issues. The other aspect, chronic inflammatory response syndrome, we want this to be going on more than just a week or two. This needs to be going on 3-6 months or more, where someone's chronically ill. If you have these symptoms but it goes away in 2 weeks, maybe you swam in some toxic algae at a lake, but you're better, and this is not chronic inflammatory response. Your body took care of it, and you don't need binders. So with that, we want to see if it's chronic, multi-system, multi-symptom. I repeat that because that's critical when we're looking at this, because we want to make sure you have it before you put through a treatment program, no more than you want to have a surgery unless you really need the surgery for them to come out and say, oh, well, we went in there and you really didn't have a problem. We're done. You're like, well, why did we go through a surgery that was costly and painful and in the first place? Mold toxicity, we want to make sure that you really have it before we put you through that kind of treatment. So with that, if we have a patient, we look through there and yep, you're 8 of the categories. We are going to look to see, is there any other potential explanation? So if you've got a chronic autoimmune disease, now mold or Lyme biotoxin illnesses can trigger autoimmune diseases, so we don't give up on that. But if you've got lupus, that could be causing a lot of these symptoms. If you've got rheumatoid arthritis, although mold again can be behind rheumatoid arthritis. Is it that you've gotten an infection, mycoplasma infection that's never gone away? Do you have Epstein-Barr causing chronic fatigue? Do you have a low thyroid, Hashimoto's, thyroiditis causing chronic fatigue? Do you have leaky gut because you have bad food allergies and it's an organic toxin? So we want to go through those lists. In the history, are there any other potential explanations before we diagnose mold toxicity? We may do some tests for that, at least ask questions, but do some testing to see if there's other possibilities. From there, we want to confirm, do you have it, again, before we put you through treatment. There's 2 kind of approaches to this, or really 2 not completely mutually contradictory, and you can do a mix of those, which is kind of what we do. The Shoemaker, kind of a little more conventional approach in terms of using labs, different things like C4A, TGF-beta1, MSH, VIP, VEGF. We'll talk more about those in a moment. But basically, lab tests that tell us, is a person's body responding to a biotoxin with a chronic inflammatory response syndrome? Now, isn't there just one test that will do that? Why does Shoemaker use all these? And he may use up to 10 or 15 different. We do not use all of those at once, but we do screen with the C4A and the TGF-beta1. We will sometimes add either MMP9 or VIP or MSH, depending on symptoms, and we may use some other clues in that. But we do enough to say, oh, not everybody is going to have all those markers abnormal. Mold affects each person a little differently. So we will do enough, cast a wide enough net to see if we can catch things. If we do, then we go a little further with a few more steps to have a little bit of a confirmation. So we will do a stage 2 of testing. So a lot of our patients will get that little email that says, oh, your mold biotoxin screens turn back positive, we would like you to proceed with some other test. It may include a visual contrast sensitivity test. What that does is see if you can tell contrast, these little wavy lines as they get closer. Can you still see them on this card? You can do those online. Shoemaker has a site. Our patients, if they're in the office, get that for free. On his site, it's $10 to $15 per test that you do. But we do that for our patients if they're in the office because we have all the setup for that. With that, then again, some other things to say confirm. We will also look at a person's genetics, their HLA. Not something, don't get your hopes up that you can use 23andMe. We have to do different testing through Quest or LabCorp to determine if your HLA genetics, your ability to detox biotoxins, is impaired based on your immune genetics called human leukocyte antigens, HLA. So with that, we will do confirmation, and then we will through that to say yes, sit down with the patient, explain what this means. The other approach, there's a group, ICEA, ISEAI, International Society of Environmental Acquired Illness. Their testing will lean more towards using urine mycotoxin testing. There's a couple of labs out there. I'm not necessarily going to bring the names up at the moment, but those tests will look, if you get a urine sample and you send that off, do you see those mycotoxins, those mold toxins in the urine? Now, we know there's probably 20, 30, 40, maybe more types of molds that produce toxins that can cause us illness. We can test for a small number of those. Each one of those companies has some overlap to it, but between the two, to get the broadest coverage, you really need to do both, and that's close to $1,000 worth of urine testing in the midst of doing all these other tests. Now, the other issue, besides the cost I have with doing those tests as the diagnosis is, you have some patients who come in, oh, they're around mold, they're urinating out mold toxins, you do all the other Shoemaker tests, and wow, their body's not reacting, they feel great, especially if you test a spouse when, say, the wife is sick and the husband comes in, well, I want a urine test, oh, yeah, I'm not affecting, why is it affecting her? Gets back to the genetics. We can talk about that another time, but the urine test may be elevated in the person who's having no symptoms and no reactions, no chronic inflammatory response syndrome. On the other hand, the person who's sick, if they're not able to get rid of those toxins, their body's not identifying it and recognizing it as bad, those may build up. If your detox pathways are blocked, especially glutathione, you may not show it up in your urine. Especially if you don't give some glutathione, which if we do that test, we'll often, not always, but often, give glutathione dosing to see if more of the toxins will come out. So in the initial diagnosis, that urine test could be negative, normal in the sick person, and abnormal in the well person. What help does that give me knowing what to do with the person sitting? I need to know if their body's reacting. That's where the Shoemaker test, I feel, do a much better job. Now, I use a urine test at times to help see if someone's clearing it out, if we are truly helping giving them glutathione to help get those out, or if we need a confirmation somebody's moved and see if there's still toxins left. As we're using those same Shoemaker labs, we will use the urine mycotoxin as an adjunct. So again, we're talking about symptoms, but really it's about how do you diagnose somebody with mold toxicity. So, as I said before, besides there's two different ways to do it, and we do a little bit of mix of those approaches from Shoemaker and the ICEA group, ISEAI. There's also, we want to rule out if there's other issues. So if you've got thyroid issues, adrenal, if you've got Lyme, could be an infection and a toxicity. Somebody has other reasons, congenital reasons in kids, if they have other genetic issues that might be a problem, autoimmune disease, deficiencies can overlap with some of those symptoms. Now, at the same time, just because you have Epstein-Barr doesn't mean you can't have mold toxicity, but because actually mold toxicity can make you more prone to get Lyme, Epstein-Barr, yeast infections, and so forth. So we want to look over those things and determine how sure are we before we put someone through having to test their home and do remediation that they've actually got that. So we will ask them to do a test on their home though. If you've got mold in your home and you've got the labs and you've got the symptoms, yes, we are moving down that road and saying this is part of the issue. So we will talk a little bit more about specific symptoms as we get into the question and answer session on specific things, but we want to see, one, do you have the genetic predisposition? Can you be sick with mold without having that? Yes, but it's pretty unusual. We only have a couple of patients that fall into that category. They do exist, but for the most part, 98% or more will be ones who have the bad genetics. And whether you've been exposed to it, whether it's at work or at home, make sure we've excluded other issues, that you've got multi-symptoms, multi-systems over a chronic period of time, and then move forward with confirming that with labs. So kind of wrapping this whole picture up to say, yes, we're sitting down, let's start a therapy program for that. And we again would apply from there. Shoemaker plus the ICEA group's treatment, we use diagnostic tests more from Shoemaker. However, from the treatment side, we incorporate a lot of other natural therapies, both in terms of binders, which I know some of the questions we're going to talk about are about binders as well, but especially glutathione and some support therapies that make the detox, which if any of you have been through detox, it is not fun. There's a lot of detox symptoms, and we want to try to help people tolerate that as well as possible. So, trying to see if there's anything else. So ultimately, why does testing matter? We don't want to be shooting at the wrong target. The symptoms overlap, so we want to be sure of what we're shooting at, turn the lights on as much as possible with testing and a good history. And we also need to know how far to go in remediation. If we're sure that they have mold toxicity, how far we need to encourage them to have their house cleaned, or even sometimes rarely, but I wouldn't say rarely, I'd say uncommonly, but sometimes patients end up having to leave their home for good by selling it or move to a different area, so that way they don't continue to have mold exposure. So with that, that is a good start. I've got some questions, and we are going to start with those and then work our way through some of the other questions that have been coming in today on Facebook. So the first question is from Pat. Thank you, Pat. Can mold toxicity present itself in the body by the person feeling movement in the body? Movement not seen by others, but the feeling in the body is as if one were on an elevator. Much feeling that if the head upon laying down, or sometimes sitting or standing, can then shift and occur in the legs. It's very debilitating. It makes it hard to sleep and causes anxiety. So thank you, Pat, for that question. So let's talk about some different ways that mold, yes. First of all, yes, can do that. Two, how? So we talked about multi-systems. So this could be an effect of vertigo with influencing the balance system of your inner ear. The ability, if you've ever heard of someone having vertigo or benign paroxysmal positional vertigo, that means in a sense one ear is telling you you're moving and the other ear is not. That tells you your balance. It's what helps you if you close your eyes like I'm doing now. Can you stay upright, or do you start falling over? Well, if one ear is saying one thing, the other ear is telling your brain something different, you're going to have the sense of movement when you're like, I'm holding still. It's kind of like when you are spinning in a chair and stop, you will notice, oh, your body keeps thinking it's moving when it's really not, and you'll have some disequilibrium or dizziness. So that's one possible way mold can affect your nervous system, interfering with your ability to sense. It can also change somehow, it's not quite understood how, change that balance in the ear itself, as we do have a lot of patients with vertigo. Now, the other sense of internal movement, we do have a number of patients who will report kind of vibration senses, movement inside their body, like their muscles are moving, but they'll look and not see it, or even sometimes they feel like they can see the muscles, but most of the time not. And what they'll say is, yeah, I feel like my arm's vibrating, and I look and there's absolutely nothing moving. It's almost like if just had a little vibrational sense. And I think that is back where it's back not to the nerves up here, but the nervous system. Mold disrupts our metabolism and interferes with mitochondria, which are energy source, our energy furnaces to burn our energy sources, carbs, fats, and proteins. If those are disrupted, or the myelin sheath, which covers the nerve fibers going from out here up to your brain, to your spine, and then to your brain, are disrupted, you will have abnormal sensations. So for those that have diabetes, they will notice tingling, burning, stinging in their feet because their nerve wires are damaged. Well, the same thing for mold patients. They can have these weird sensations. They can have sensations of movement. They can also have pain. One of the things I talked about in Shoemaker's list was the fact that you can have the ice pick pains, or you can have numbness, tingling. So ice pick pain would be like, oh, somebody's stabbing you. May last 30 seconds, may last a few minutes, hour or two, then it goes away. You get an MRI, you get a CAT scan, nothing's there, no problems. Neurologist said, oh, you just got a headache. Yes, but it's pretty miserable when you feel like something's stabbing you behind the eye. And then another week later, it comes over here. Another week later, it's back here. Or you start having those peripherally too. Or you have the numbness or tingling. So yes, you can have weird sensations. So your sensory ability is disrupted. And that's one of the things I've tried to say before in other settings about mold is mold disables your ability to perceive, whether that's perceiving your environment, hot, cold, move, not move, smells, taste, vision, or perceiving other people's intentions, reading emotions. Relationships can be difficult because someone's not able to discern somebody's anger, fear, concern, not concerned, and so forth. So it disrupts your perception. So you can definitely have those weird senses of movement. And as you go through detox, sometimes that gets a little worse before it starts fading away. But often some of those painful type symptoms do go away a little quicker. So thank you, Pat, for that question. I'm going to pause for just 1 second and remind anyone coming on now. As I said at the beginning, this is not diagnosis for you. This is not treatment plan for you. This is some education to help you understand whether your illness might be caused by mold, or if you do have mold toxicity diagnosed, maybe to understand it a little better. If your provider has not answered some questions, it's a hard illness. It's literally almost every person with mold toxicity is a little different. So if you met one person with mold toxicity, you've met one person with mold toxicity. There's patterns, they overlap, but no two people, no two fingerprints are alike. So with that, it takes someone who has the experience of looking over that, both from a scientific side and also the experiential wisdom side, to help you discern. So diagnosing yourself with mold toxicity, it's easier said than done. So take this as education, but hopefully it does help you. And if you don't have someone helping you, we're glad to be a part of that, be a part of your team of restoration at some point. So next question from Wendy. With regard to blood markers, Shoemaker recommends VEGF, MMA, that's actually MMP, C3A, C4A, VIP. Read that Quest is more accurate for some, while LabCorp is better for others. Can you comment on which markers should be sent to Quest, which should be sent to LabCorp? If there are some that should go to a different lab entirely, to use these markers to guide you in the diagnosis and treatment of mold toxicity? If so, how? So, as I said in the first introduction, the monologue part, was the fact that yes, we use the Shoemaker approach for diagnosis. We do incorporate the ones mentioned here, plus transforming growth factor beta 1, TGF beta 1. In that, we are using those to determine, is your body reacting? Not just are there mold toxins. Everybody has some, but are those mold toxins likely causing your illness, causing chemical changes, hormonal changes, neurologic changes that we can then treat and get you better? So with that, yes, there are some that are better for one lab versus other. There's a list out there on the internet where you can see all the different ones. My nurses and phlebotomy team that we have here, where we draw labs in office, are the best at telling you which goes where, because they're doing it day in, day out. But for example, C4A, there's a lot of debate, in talking to different labs, that theirs is better, but Shoemaker will stand on the fact that C4A should go to Quest and should be processed at National Jewish Hospital, where it's standardized according to what his guidelines are. TGF beta 1 is better there. There are some, however, like VIP, that are better to go to LabCorp. And you can go down that list. I would say there's an internet source. I don't have the website on the tip of my tongue, but you can print that out and see which one goes where pretty quickly. If you have a mold toxicity treating doctor, they should be able to tell you the right place. and having, again, been to the conference and talking to Shoemaker directly, there's the reasons for that. That would take up some time. It's a little more scientific than you absolutely need to know at this point. So then Wendy also has a question. Neil Nathan uses specific binders for specific mold toxins. Bentonite clay, better for aflatoxin, gliotoxin. Shoemaker uses cholestyramine or Welchol in everyone. Sort of a one-size-fits-all. Please describe your approach to binders if you use urine toxicity analysis by either Real-Time Labs or Great Plains to guide you. Those are the two labs I was thinking about. So kind of answered part of that question, and this gets a little bit off the symptom approach, but I will say that I'm lean more in the Shoemaker in the diagnostic side, and I lean a little bit more in the Neil Nathan side in terms of treatment. So we would be a Shoemaker plus in terms of treatment, plus by doing some of these other therapies, different binders we will use at different stages. So it's not an either or. Ultimately, if you're getting treated for mold toxicity at our clinic, you're going to go through charcoal and clay as binders. You're going to be receiving glutathione either orally or IV. We do have IV therapy where we can administer that, and also if once the supply opens up again, hopefully be able to use phosphatidylcholine, which also helps improve the detox process. So we'll use those others. Occasionally we'll add in some Saccharomyces. There's some debate over the benefit of zeolite in whether that actually removes. I do believe it removes a lot of other things. There's some agricultural studies that does show that it will increase the excretion of certain mold toxins, mycotoxins. So that is true. So now, from looking at studies, cholestyramine is the strongest when it pulls those out. But yes, there are some that doesn't pull out as well. Again, don't restrict yourself to one tool, one binder. We incorporate a set of those, and sometimes we will do one for a month or two and then the other. Sometimes we'll combine both. A lot of patients can't tolerate one, so we will do our best to cover the bases. Because ultimately, even if you do the test and say, oh, this person's excreting aflatoxin, well, we know aflatoxin, but what if this toxin that we have no idea even exists or have a test for is there and it doesn't bind with charcoal? So we still are going to use that breadth of binders over a period of time, including cholestyramine, but including both sides of that treatment fence. So again, we are kind of a Shoemaker plus the other therapies, and watch how the patient responds, monitor them with symptoms and labs, and determine what are the best binders for them. One of the other questions from Wendy is, Dr. Brewer is of the thought that an ongoing source of mold illness toxins is colonization of nasal passages with mold. What are your thoughts on what role do either nasal or oral antifungals play in your treatment strategies? When do you use antifungals? What tests do you run to determine treatment? How long do you treat? What labs guide your length of treatment, doses used, etc.? So let me just say that question itself could be 30 minutes or an hour. It's getting into the treatment phase, so I'm going to try to answer it briefly in terms of what I can now without going down a long list of things. But for the most part, I don't believe everybody has mold living in their bodies. However, I do have a few patients that's been confirmed, not by myself, but actually by other physicians, from pulmonologists to allergists, that they have found evidence of mold growth. And the patients have benefited with some of those therapies by other doctors. We don't routinely test for the fungal in the nose. What we do look for is MARCONs, multiple antibiotic resistant coag-negative staph. If we find that, we use silver nasal spray with EDTA, which actually is an antifungal. So to some degree, we are treating it kind of on the side if somebody has MARCONs or if they had fungal symptoms. Now, I do not agree with using some of the more pharmaceutical versions of antifungals. I think Shoemaker has some legitimate concerns as far as whether that has triggered some of the resistance we see in vancomycin-resistant enterococcus and staph infections. I don't believe that is the only reason, along with Shoemaker, that those resistant patterns are occurring in bacteria, but I think it's at least worth considering. So I do try to limit the pharmaceuticals, but may also use there's some other natural therapies that we will sometimes consider besides silver, using in the nasal passages to clear up those things. Now, next question from Becky. Notice the link between. Have you noticed the link between mold toxicity and thiamine deficiency, or beriberi is kind of the formal term. Two friends and I were chatting about thiamine deficiency and the possible link with dysautonomia in POTS, as a friend has been reading articles in this connection. Got me wondering about mold toxicity and whether it can cause thiamine depletion. See some references online suggesting that mycotoxins can block thiamine activity in the body, acting like anti-thiamine factors. Do you see this in practice or your mold illness patients? I did some research. That is not something I've seen in patients that I would blame directly on mold. However, yeast, if it is prevalent, I do see a lot of riboflavin deficiency and know from studies, and not as often, but some thiamine, B1, riboflavins B2. I do see that, especially the B2 in patients. Usually, though, I see that more related to the yeast dysbiosis. Now, it's related to mycotoxins because mold suppresses the immune system, dysregulates it, makes it easier for a person to have yeast dysbiosis in their gut or in other parts of the body. So in some sense, yes and no. I have not seen it directly related to that, but with that question, I may be on the lookout. We do a lot of testing for organic acids. So if someone is deficient, we are going to supplement if they are having markers. So we don't just look, oh, is your B1 level X and your B2 level is this, you're great. Actually, that level may not be enough in you. So we use organic acid testing to see, oh, well, yes, this seems enough in 4 out of 5 patients, but you actually need this much. And I have a number of patients who are like that where they're taking significant doses. Somebody the other day who's taking about 8 to 10,000 a day orally of B12 and still was not having movement in the organic acids, and it wasn't until they went to the shots were they getting improvement. They were taking a mix of methyl adenosine and hydroxy B12 and still not improving. So it wasn't that they were taking the wrong one, cyanocobalamin. It was just the fact their body's not able to absorb it. So we did that injections, and they saw a lot of improvement in their symptoms just from doing that. So, so I haven't drawn a direct connection between thiamine deficiency, but I think it may be related more to yeast as the common factor. I think Janine, what about aluminum toxicity from HPV? HPV vaccination is also being linked back to many autoimmune diseases from Hashimoto's. So this is a little off the track of mold in the terms of the chronic inflammatory response syndrome, but aluminum can play a role. Heavy metals can play a role in worsening mold toxicity. There are some who have a theory, I think there's some potential legitimate science behind it, that mold actually likes heavy metals and actually collects them and could cause you to collect more in your body and have that build up. So a lot of patients who have mold toxicity will, not a lot, a number of patients will have heavy metals as well. So we are screening for that as a possibility, especially if somebody has amalgams or worked in industry or have potential past exposure or past amalgams, even though they had those silver fillings taken out. We want to consider that. So the aluminum is a potential one. If your vaccines are a source of aluminum, it could also be cooking with aluminum foil, drinking soft drinks from aluminum cans. There's a lot of places that can be an issue. And yes, I do believe aluminum toxicity is a real issue because I've treated some patients and seen improvements, particularly kids, for that. And that is the original questions. Let's look at some of the ones that have come in since we've been talking. We still got a little more time. Does mold show on an MRI? So magnetic resonance imaging, because mine did not. So mold, so when we think about mold illness, it is not an infection. It is not an allergy when I say someone has a chronic inflammatory response syndrome. There's infection, allergy, and toxicity. Toxicity means the mold out here, unless with Dr. Brewer, you believe that it is living in the body, and in a few patients I do believe it does, but most I don't believe it is. You're getting something from the outside, the toxin, not the mold. So you're not going to see the amount of mold toxin in your body is probably going to fit into a small, far less than even a thimble. So it's a tiny amount that's causing that much of a reaction in your body. So you're not going to see that on MRI. Now, if you have a mold growing, immune suppressed patients, chemotherapy or high dose steroids, or severe uncontrolled diabetes can have mold growing in their sinuses, where you see what we call fungus balls, or down in their lungs where they have fungus balls in their lungs. Yes, that you could see that on a CT or MRI, but mold toxicity you're not going to if it's not an infection. You would never see that in any form or fashion. Another question from Natalia is, can you get mold toxicity by eating mold? So yes and no. What do I mean? Yes, there are toxins, particularly aflatoxins, in peanuts that are spoiled. All peanuts have a tiny bit. They measure that to keep it safe, but if you had some peanuts that were too high in aflatoxin, you could get very sick. There's been a lot more cases in the agricultural world where that has been discovered. So there is a point where you eat enough that it can. Now, if your acid breaks down some of those, you may not have as much effects. Just because you have that doesn't, you can eat that moldy pizza bread by accident and not feel sick. And it's because it's not every mold produces a mycotoxin that will hurt you. Some of those actually, where they came up with antibiotics, may actually kill off other bacteria in you. However, when you're mold toxic, there is some potential, and we do have some patients who are so sensitive, yes, the amount of mold in the food will trigger them, whether it's from coffee, whether it's from aged cheeses, whether it's from pistachios or peanuts or other nuts, they will find it does react. But I will say most do not. We advise patients to play around with those diets and see if they notice any improvement. When we're going through detox, it's often hard to tell, but I do have some patients who are pretty sure that certain foods do trigger their symptoms, and they have that mold type symptom with that. Now, as far as studies, listening to Dr. Nathan at a conference not too long ago, was the fact that, as far as he knows, there are no studies out there who say absolutely that will affect you in humans. However, in animal studies, it is definitely clear that animal feed with higher levels of mycotoxins, mold toxins, will lower fertility, will lower the growth of that animal, will cause an increased risk of infections and make that animal more unhealthy. And obviously then there's a lot of money put into keeping those safe, because otherwise farmers, agricultural business can lose lots of money, millions and billions on that. So definitely there are studies in animals. It's just not as clear in humans whether that's absolutely true, but it's obviously can be expected if it's happening in the animal world. Another question. Let's see here. From Gina. How do you detox from mold? So, we talked about binders. So, basically, think of it very simple. Open up as many doors. If you've got a stadium full of people, open up more doors. If you've got a body full of mold, open up more doors. We are trying to get those out in the urine, the stool, and ultimately later in the sweat. So, giving binders where you take those, like the charcoal, the clay, the cholestyramine, Saccharomyces, potentially zeolite. Some believe that is helpful. We don't use that. Goes in, your body squirts out some of those toxins in the bile. Your liver's trying to get rid of it. It sticks to those binders, and you flush that down the toilet when it comes out the other end. You can also increase glutathione. That will be bound, conjugated, one of the phase 2 detox mechanisms, so that you can urinate that out easier. Then the sweating, once a lot of patients with mold toxicity can't sweat as well, so we do caution jumping into sauna too soon, in terms of they can eventually do that to where if they're washing afterwards, they can get some of those toxins out. So those are the ways, and then give support therapies along the way. Another question now from Heather. My son was allergy tested because he has eczema at 9 months. Showed he had a low immunoglobulin G and high immunoglobulin, probably E, I'm guessing. She doesn't remember. He continued to have eczema the next few years, and then 3.5 years was diagnosed with blood disorder, ITP. He's been exposed at 2.5 months to a bacteria in the ocean, and I wondered if, since his immune system was already low as a baby, that his body couldn't fight it off. We live in an apartment and know it is water damage, probably mold, trying to move, but in the meantime, it's stressing. So yes, I understand having a family that's finishing up mold detox and getting away from mold ourselves and watching our patients. It is an extremely stressful event. Again, it gets back to why we try not to diagnose unless it's we're sure about it and guide patients through that. But in terms of symptoms, which is kind of the focus of what this hour is about, is yes, eczema can be triggered by that because your mold toxicity can trigger the immune system to dysregulate, and instead of attacking bad guys, bacteria, viruses, parasites, those sort of things, yeast, it will start attacking food you eat or attacking yourself. So it will cause great amounts of inflammation, allergic inflammation. It will raise the allergies you have to other environmental things, the pollens, the cat and dog and those kind of things in foods, make that even worse. And then your immune system, once it's upregulated, it's more jittery, more anxious, and to some degree, when another trigger comes along, whether it's a heavy metal, another infection, can really rev that up. So it keeps amping up and having more issues. And definitely trying to determine if you have mold in where you live or getting away from it is important for that. So eczema, we do see a lot of that, food allergies, autoimmune diseases where the body is producing antibodies against itself, from Hashimoto's to lupus, to ITP, which is idiopathic thrombocytopenia, which is what she's referring for her child. Anything where the immune system is dysregulated, turns on you instead of on the invaders, is a potential place. So I've seen ANAs go from 1 to 640, which is pretty high, down to completely normal by mold detox. And often we'll see thyroid antibodies get better. So that is a place. The autoimmune disease, in terms of symptoms or syndromes, is a place where we will see effects. Now, again, this is where we're trying to make sure someone has it. We don't blame mold for something else, for another crime by different bacteria, but we do think if we see the signs of mold toxicity and we see autoimmune diseases, I'm definitely going to go after that mold toxicity with the hope that the immune system dysfunction, the autoimmunity, at least gets better, if not goes away afterwards. So good question in terms of symptoms. Can mold cause MS, multiple sclerosis symptoms, such as internal vibrations? It's not debilitating, but annoying. It's like an electric current, or could that be a virus more likely than mold? So with that, I talked a little bit about earlier, mold can affect our nervous system, the mitochondria supplying our nervous system with energy, which the nervous system is one of the most energetic using parts of our body besides the muscles. Our brains are using a ton of energy a day to function. But yes, you can have internal vibrations. That MS symptoms, multiple sclerosis, can be any neurologic system where your nerve, the myelin sheaths are being attacked, so it's an autoimmune type disease or a destructive type disease where your nerves are not working. So it's short-circuiting the wires and you're having abnormal sensations or dysfunctions. If it's motor, you're not able to move, your weakness. If it's sensory, it's the fact you're feeling weird things you shouldn't, or pain where you shouldn't, or hot feels cold, soft feels sharp. People can have difficulty with even having sheets on their skin because it hurts so bad. So yes, mold can play a part in those things. I think this is Renee. If I'm reading this rightly, can exposure to mold in past several years cause current medical issues, or do issues resolve when exposure ceases? And there's another question, but let's answer that one first. So absolutely, we do have some patients who we've done thorough testing, and we're as sure as we can be, 95 to 99% sure they're not currently being exposed to mold. Now, you do need to be careful. It could be some places you didn't expect, a car, workplace, or church building, place you spend a few hours a week. But if you go through that and you're not finding that, yes, it could be something. If you have the genetics where you're not able to detox from mold, your immune system can't recognize the mold, bad guy, bring it in, chew it up, and spit it out safely, that could stick around for years. So we do have patients who, they come back 8-10 weeks later at their next visit, and they're like, man, I'm 90 to 95% better, and all I did was change jobs. Where there was mold in the ceiling in my office, I'm in a new office, I feel 90 to 95% better. Others who will say, oh, we moved out of the house, and within 2 weeks, I was like almost a new person. Others, we will have, oh, they moved out of that moldy house 2 years ago, or even 5 years ago, and they're still struggling. They're like, I'm 10%, 5% better, but I'm still nowhere near normal. I still feel very sick. A lot of those patients are ones that, if they're 50 years old, maybe they've been exposed for 30 or 40 years. So it's not just the building that they left 2 weeks ago, a year ago, 6 months ago, whatever. It's the fact that they had a bucket of mold toxins build up in their body. They only need this much to spill over, and they've got this much. So we've got to not only get them away from that bucket being filled up more, but we've got to detox before they start saying, oh, I'm starting to feel better. So some patients, yes, get better pretty quickly. Kids do a lot quicker than adults. We'll see them bounce back in 1 to 3 months, whereas adults, middle-aged adults may take 6 to 12, even 18 months. At times with Alzheimer's, which is another potential issue, memory problems, could be 12 months before you see first little glimmers of hope, and 18, 24, even 36 when you're seeing continued improvement with that. So yes, that sometimes in some patients lasts a very long time. Can a small roof leak, noticed a few months ago and just repaired, release mold spores into the home? Absolutely. So any water intrusion that's over 24 hours has a potential for encouraging mold spores that may have already been sitting there dormant. Feed them water and watch them grow. And then once you start having that grow, mold will spread by sending out spores, and any air circulation in your house can be spreading those. So absolutely, patients find things that they would never expected that small of a water damage, even just moisture on a event could be an issue. So talked about that. All right, let's just bring up, this is kind of touching on testing, but we'll talk about any hope that OATS test or urine mycotoxin test will be FDA approved. Isn't, we cannot get those tests approved by military. Offer those at the military families been exposed, and that's been a big issue somewhat in the news, that there's a lot of families where cheap housing or poorly maintained housing has caused many to be sick. There's also been a lot of issues in the news reports of colleges that have even evacuated whole dormitories when they found large amounts of toxic mold in those. So I'm glad to hear that there are universities taking their students' health very seriously, because some of those kids can be very sick. And hopefully the military will also see the need for protecting their families. We do have a few in that. So with that in mind, though, if they're not FDA approved, yes, your insurance, military insurance may not cover it, but again, the tests I used aren't necessarily in that category. So we use ones, and we can test and care for those even if we're not using, again, the urine testing. Yeah, and getting, the fighting the battle to get the FDA to approve something, I'm going to spend my time taking care of patients, and at some point, one of the things that Shoemaker Group and also Nathan's group is want to collect enough information, data, and research together from a clinical side to make this more provable, both from legal, from the insurance industry, from the medical industry at a wider scale, so that people can get help. So another question from person, just mower sales, Mr. Mower Sales. Retired oil field engineer, spending a lot more time in the crawl space of older houses that I've remodeled. This is also the type of mold you're talking about. Also been exposed to the worst chemicals and undesired products that have been pumped down 10,000 feet, disposed wells in oil field, work from 75 to 85. So yes, in the crawl spaces, that mold can be toxic. Let's talk about mold. Which molds are toxic? The ones that are outside typically are not as much, and if they do produce toxins, they're blown away. However, in houses we live in, they're airtight. That mold toxins build up a lot more and will eventually build up enough that it can affect patients who are living there. So those chemicals, now again, mold often does not travel alone, so organic toxins plus mold can be a double whammy, and 1 + 1 may equals 15 in terms of symptoms. So some people maybe have tolerated a little mold, not really caused much trouble, but you throw a little Epstein-Barr, you throw a little mycoplasma infection, you throw a little petroleum toxins on top of that, and then all of a sudden they get sick. Or you even throw a traumatic brain injury, a concussion, could open up the blood-brain barrier to trigger symptoms. So we will look at patients' history of head trauma as well. So let's see. So from Margaret, how can you tell if your mold exposure is old, from when I was younger, or current versus current? So thank you for the question. I can't. So I can look at you now and tell whether or not you appear to be mold toxic. I can do a history where if you say, oh, I grew up in a home where, yes, we saw mold growing, toadstools growing out of the wall, I could say, well, I don't know if that's still the one doing it, but you were at least exposed back then. And if you tell me, oh, you were having severe asthma or severe food allergies or severe migraines living in that house, I was like, you probably at that point were affected by it. Now, if you are now 20, 30, 40 years later and still having symptoms, first I'm going to make sure, are you still being exposed? If you're not, then we're going to detox. I won't be able to say for sure, was it when you were 5, 10, 15, 20, 25 years old that it was the toxin. But if you're being exposed now, we want to get you away from it, regardless whether it was, the 50%, 90% of your toxin load was 5 years prior. We want to see whether you're toxic, being exposed to toxins at this point. So also, is there a proactive way to help since I have a college student? So for a college students living in dorm rooms, again, I mentioned there's a lot of news reports recently about students who have been evacuated. I'm thankful for that. I do have a few college students who are still having to live in some dorms, and they've had, thankfully, a few of those colleges have been willing to either let them switch, maybe move to off-campus housing, or use some cleaning chemicals that you can remediate, or use air filters that will lower that risk. So there's been a number of things. Sometimes it works better than others, and students determine, well, I feel 50% better. I know I won't feel 100% better until I finish this semester and graduate, and they have to put up with that. But there are some things you can do, from air filters to cleaning remediation chemicals in a setting where you're not in complete control, whether it's a dorm room or rental situation as well. Question, do you use real-time labs for what molds one would have? Again, I don't typically do that. I do that maybe once a month or maybe twice a month if it's a situation where it may be legal, or if somebody's wanting to say, okay, I was exposed last year, I'm in a different living situation. Is my current house causing the mold toxicity versus I have a testing on the old house? And a question about, I heard bentonite clay has heavy metals. Is that true? Yes, that is a concern, so you want to get one safe. I do trust the GI Detox formula that we use, but you can get ones, and that's the other concern with zeolite. If you get natural zeolite, it will have some metals in there, good or bad, you don't know. Whereas there is one product where they do a synthetic zeolite, which they obviously know doesn't, because they created the crystalline structure that binds those ions and those chemicals free of those metals. So you want to do that. And likewise with chlorella. You want a chlorella from a lab source, not from free range, because that's pulling in metals from your outdoor environment. So you want to make sure that you are covering, getting the right form. It's not always just, is it synthetic or is it natural? It's also whether or not it is in some cases synthetic is better because it's avoiding bad stuff that could be coming from the environment. So could a symptom be a constant urge to urinate, not always going, but having the urge? So yes, let's wrap up the last little bit, focusing a little more on symptoms. Focusing on symptoms is, some of those is the sensation to urinate. You don't have control as much of your ADH, antidiuretic hormone, so you will spill more water out of your kidneys, and you will have a higher salt concentration in your body. You will end up having a little more salt on your skin because your body's trying to get rid of that salt, and you are pumping out more water, so you're going to the bathroom more often. When you lie down at night, you will do that more because all the blood goes up to your heart. Your body says, oh, I've got plenty of fluid, and that's why you pee more first thing in the morning. So with that, ADH dysregulation is one of the hormones that's affected, coming from your pituitary down to the rest of your body, to telling your kidneys what to do. So yes, you also have increased risk of interstitial cystitis, meaning cystitis, meaning the inflammation of the bladder, can have more allergies, so different foods can trigger that. Acidic foods or just some allergic foods. Your body's immune system gets messed up, dysregulated, and you can have an urge to urinate when you only have this much urine in your bladder. And like, I went and barely anything came out. Well, it may be interstitial cystitis, or you're like, oh, I went and I'm peeing multiple times a day, and then we'll find, oh yeah, you're not getting rid of that. You're not able to hold on to urine, water, because of the mold effects. Another thing those patients will note is a lot of static electricity. They'll say, I'm always shocking people. Everybody says I am constantly shocking them. You have more salt, you have less water, and you're more electrical conductor, and you'll trigger those symptoms. So let's talk a little also about, let's just go head down. So the symptoms from mold can be from migraines and headaches, the ice pick pains, to true migraines, through histamine, which mold can trigger your mast cell response, histamine reactions, which histamine then can cause not just allergies, wheezing, and skin rashes and hives, but also migraines. You can have changes in your hearing, ear ringing, tinnitus. You can have balance vertigo like we talked about. You can have changes in your vision where your visual contrast or your ability to distinguish edges kind of fades, changes in your taste. Lymph nodes can be swollen, your immune system's dysregulated, so you may notice some pressure in your neck from lymph nodes or different places. Breathing, you can get increased allergic from histamine reactions. You can also have some fibrosis, idiopathic pulmonary fibrosis can be secondary to mold toxicity. You can have heart symptoms, meaning you can feel some pain, or it could be that your pressure in your lung, blood pressure in your lung goes up and puts a strain where you're short of breath, or you feel palpitations because the nervous system part sensing your heart changes, or the fact that your heart's having to pump harder because it's pressing against the pressure in your lungs. GI tract, you get leaky gut, which can food reactions, nausea, irritable bowel type syndromes, constipation, or diarrhea. SIBO, small intestinal bacterial overgrowth. Your immune system is dysregulated, so you can have more fungus or bacteria that grow up into your small intestine instead of staying in the large and trigger reactions. You eat food, 10-30 minutes later, you're like, man, I feel bloated, I feel like I'm pregnant. I feel like I swallowed a football or a basketball. SIBO can be something that comes from mold toxicity. You can have skin symptoms, weird rashes, itchiness, sensation, pain, numbness, tingling. Lots of weird rashes are definitely a possibility. You can have joint pains, especially if you have trigger autoimmune disease where you're having rheumatoid arthritis, inflammation in your joints. You can have muscle pains. You can have, again, neurologic symptoms in the periphery of balance problems, numbness, tingling, weakness. You can have a lot of multiple sclerosis type symptoms where it almost seems like you almost have a stroke. Still want to get checked out by a stroke. You want to rule out those other things that are quickly treatable and need treatment. But if you don't find those, then you start looking down that pathway. Emotions, let's wrap it up. Yep, with emotions, depression, anxiety. You can have severe panic attacks, anxiety episodes where your limbic system, so your limbic system controls your emotions, kind of the center part of your brain, somewhat gets disconnected from your frontal cortex, which controls thinking process, executive decision making. So your brain, front of your brain, can't say, "Hey, calm down, it's going to be okay," or cheer up. It's your emotions are all gas and no brakes. Once you have that anxiety or the depressed feelings, it's hard for you or someone else that you love to come in and say, "Hey, listen, it's okay. You don't. I just came up." I'll tell patients, somebody might come up behind you and say "boo," and you scares you. You look back and you realize it's your brother or your little sister, but you still stay scared because your front of the frontal cortex can't say it's okay. It actually says, "Oh, you should be really scared." You need to, you're not able to turn that off, or people have this revving up. Their adrenal cortex, their hormones don't work, so they're always either way up or way down, or sometimes have some of the biggest mood swings that you can imagine. Neurologic, the last thing I would say would be memory problems. So for kids, a lot of times adults will be word finding difficulties. For kids, it may be, "Oh, I can't do math as well." Their math grades go down, or they're having behavioral issues in class. But some people, older people, adults will say, "Oh, I can't balance my checkbook anymore." You have trouble doing math. So with that, those are a lot of the symptoms that I wanted to get to talk about. Again, let's bring this to a big close, is multi-symptoms over months of time, preferably at least 6 months, with the genetic predisposition with an exposure, suspected or known, to mold, in which we have testing that confirms that you're reacting, not just that it's present in your urine, but it's your body's reacting, immune system, hormones, different parts of your body are responding to that. And when we remove you from that source and we detox, we see you improve, and we use some of those same tests to monitor how you're doing. So with that, we are working through a process, again, the shoemaker approach, with some additional therapies that we feel are very beneficial added in. And with that, we are trying to educate you if you might need that diagnostic help or treatment help, or want to show this to one of your doctors who you're trying to convince them to take you seriously, that mold might be the issue. We want to be there, and we are, again, Stephen's number is there at the bottom of the comments. We are hopeful that this is helpful, but again, don't take this as gospel truth and diagnosis and treatment. Have someone guide you. When you are in the midst of a tornado, it helps that somebody standing outside that tornado to provide you objective guidance, experiential wisdom, and walking you through this. This is not something that's easy to do alone. So thank you for joining me. In a couple more weeks, on the second Thursday, we will be talking about, I believe it's leaky gut, I think is next. I hope it is. If not, it's Epstein-Barr. One of those two, I think, is coming up next. We will be doing another Facebook Live. I look forward to seeing you then. Until then, blessings.